Hey, I'm Dr. Tamara Camo, and we are here today to talk about stress. Now, I'm a trained gynecologist, not a psychiatrist, but you'd be surprised at how much of my day is spent dealing with stress, trying to figure out if stress is causing the problem or if the problem is causing the stress. But I spend a lot of time having to deal with stress as a component because if it's not addressed, it can interfere with other parts of our plan. So, what is stress? Stress is an emotional or physical strain caused by a response to pressure from the outside world. And the body can react to this change either physically or mentally or emotionally. Now, stress can be either positive or negative, but I'm mostly going to discuss the negative effects because when it's positive, you're not coming to the doctor, but when it is negative, you are. So, what do we blame for stress? I often ask people if they're stressed, and some of them will say, well, no, my work is good, my school is good, my husband's good, my kids are good, so I'm not under stress. Because all of those things can contribute to stress, and that's pretty much how we evaluate whether or not we are under stress. But really, if you think about stress and what it actually does, whenever you're under stress, it actually causes a chemical change in your body. You secrete a hormone called cortisol. And cortisol can be provoked by many things besides deadlines, husbands, children. It could be provoked by the food you ate. It could be provoked by pain. It could be provoked because you did not sleep and didn't get rid of your stress from the previous day. Your stomach can always hurt after you eat or in response to stress, or you could have an autoimmune issue that's constantly provoking cortisol. So people identify their stress by what is happening, but I identify your stress by what all factors are provoking your cortisol. And many people have at least one thing, whether it's bothering us or not. So other kinds of stressors, environmental stressor. You could just live in a situation that's not favorable and constantly be stressed because there's too many people in your house, or you live in a place where there's lots of noise, there's construction going on. It could be a situation that happens that's a temporary stress, like a job change or a move. But there's a lot of different stress that people don't always identify as contributing to their problem that might be physical. So, stress response cortisol. When you experience stress, your adrenal glands release cortisol into your body, which temporarily increases your blood sugar levels to provide the body with a boost of adrenaline. So, you need sugar, you get to run. We'll talk more about this sugar and stress and weight gain soon. Cortisol is the body's primary stress hormone, regulates carbohydrate metabolism. Heart. Too much stress for too long is not good and will bring you to me. So, other things that can provoke stress, we talked about those. There's other stress, noise, crowding. Okay. Stress and disease. Several things act together to create a pathological outcome. So, stress alone might not cause the disease, but stress over a certain amount of time without resolution can cause a disease that has consequences. So, there's many treatable diseases that have a component of stress. Sometimes you can't concentrate because there's so many things going on at home, and then you take a medicine for that. Sometimes you have high cholesterol. Well, why would you get high cholesterol? Well, you've got cortisol. It's secreting sugar so that you can run, but you're not running anywhere, so the sugar just hangs out. Then you run out of places to put the sugar, so you start making cholesterol particles so you can store them. Stress, because of the high cortisol, can affect your immune function, definitely screw up your skin. Who has gotten a pimple after they've been in a stressful situation? It can make your gut hurt all the time. I've had people have hot flashes when they are stressed. It can affect how you reproduce if your cortisol is high all the time. It rearranges your other hormones, and then when you're trying to ovulate, it does not work out. So some symptoms of high cortisol: high blood pressure could be a symptom, disturbed sleep, you age prematurely, stomach ulcers, lots of abdominal fat, all that sugar, and the health consequences. Your thyroid can be affected. When someone's chronically sick and comes to see me, I have to think one of the things I come up with is stress. Because viruses are everywhere, bacteria is everywhere, but why are you always responding to them? What's wrong with your immune system that it's not getting rid of it before you notice it? All right, so specifically, how does it affect your immune system? Makes it longer for you to recover. All right, so how many people know someone who is burnt out? So if we're under chronic stress for years, like we're at a job and it's just, I mean, I delivered babies. Wasn't like we slept for a month ever. So even sometimes people go on vacation and they're barely coming out of the burnout before they go back to work and burn out again. So you're easily overwhelmed, you feel tired and drained all the time. Chronic pain can cause stress, and stress can cause chronic pain. So how did that happen? You are in a lot of pain, you become inactive, your muscles change, they become weak. Then you get fear and anxiety, which causes more stress and more pain. Then you get angry. A lot of people with pain suffer from chronic depression. You don't want to go out and socialize. You can't sleep, and you're tired, which leads to more pain. And it keeps going in a cycle. So sometimes people say, my life is great. I don't have any stress. And I'll be like, so when you wake up in the morning, are you stiff? Oh, a little, yeah. Or do you have a headache when you wake up in the morning? Yeah. What about your knee pain that's not gone away? Oh, yeah. And the doctor say you needed surgery? Yeah. I mean, they're not thinking of their life is great, but they don't think of the pain as a part of their stress problem. And then your hair could fall out. I mean, even though you don't have emotional stress making your hair fall out, your chronic pain can make stress-related conditions happen. Your chronic pain can lead to your blood pressure issue. Your chronic pain can lead to acne because you constantly have the cortisol signal that we talked about earlier. So how do we quantify stress? Sometimes I give people a stress score. On a scale of 100, if you're below 59, you're fine. So we all have some stress. We can all deal with a 20 or a 30 or a 40, but not a 59. 60 to 80, average amount of stress. 80 to 100, you've reached the critical area. Now learn to relax? No, probably you already should have done that. And then 100 and over, it's huge. All right, so let's look at the little scale here. What has happened? Where is the pandemic? Oh, even a vacation and Christmas gives you stress, but it's only at 13. So we're still under 60. Change in schools, that happened during the pandemic. That was a 20. Revision of personal habits, that happened 44. Changes in health of family. So somebody in your household gets that, and you're at 44 plus 44. You're at 88 now. It's just during the pandemic. Unless it's an actual illness and you really got symptomatic of, then you're almost 100. That's all just pandemic related stress. Now look, just being married puts you at a 50 already. So you're married and you go on vacation, you're at a 63. So yeah, there's stress is everywhere, but there's a point at which it takes a toll. And so there are a lot of different stress scales. That was one of them. We can also use your vital signs, your heart rate variability. A lot of times, a normal person, your heart rate goes down to baseline, then something happens, it jumps up and it comes back down. But people who've been under chronic stress will have decreased variability. Like they're so worn out that they don't even react. It's like, I don't care. And you don't want that. Hormone levels change. Like your cortisol goes high enough, all your other hormones go to zero because they all got stolen by the cortisol. In some of the studies that I'm going to discuss later, some of the studies will say we used a chart to have people rate their own stress, and then we saw a difference. And some studies are going to actually measure blood pressure and heart rate in order to get a different measure of stress. But there's a lot of different ways that we measure stress. Now, stress symptoms index. Here's why stress is so difficult to handle, because the slide is difficult to handle. We don't even know what's happening, but let me say this. Let's say that a person is like, I'm having issues with my marriage. 28% of their stress is that. One of my kids isn't doing well in school. 17% of their stress is that. I'm having headaches every day. 33% of their stress is that. So if you look at their stress, it's like, 77%, they're 77% stressed, but it's three different things. So let's say I'm like, okay, let me give you a pain medicine. I can get rid of up to 33%. Maybe not all of their pain will go away, maybe half of their pain. So I've gotten rid of 16, 17% of their stress. But I can't fix their husband and their kid. So when people are like, yeah, I'm taking this medicine, I'm still stressed. Well, that's because you have 28% here, 17% there, 33% here. And sometimes you need different things and different tools to manage all the segments of your stress. Stress was one thing, we could fix it with one thing. Stress is usually, there's lots of components to it. So that's why, if you ever look at the slide, that's why it's here, because we have to pick apart different things. Let's talk about hormones. So normally your body doesn't always make 60 different hormones. You have 60 different hormones in your body, and you don't have little 60 different factories making hormones. What you do is you have cholesterol. Then from cholesterol, your body makes pregnenolone. And then that's your grandmother hormone. And it's from pregnenolone, you keep changing one little detail and making different hormones. But when cortisol comes in, it wrecks the whole pathway and says, everybody, come with me. So a lot of people come to tell me, oh, you check my hormones. I don't feel well. And their hormones will be strange, but it's not because the progesterone might not be low because they can't produce it or because they don't have any ovaries. It might be low because it got stolen, which I can't really measure. I can't measure who stole it. I just know it's there or it's not there. So then you go and you do what? You take more progesterone. But then what happens? The cortisol steals it again. And you're like, that progesterone made me feel terrible. Well, the progesterone didn't make you feel terrible. The cortisol made you feel terrible because that's how it got stolen. So that's why, as somebody who prescribes hormones all day long, I always have to know about this steal because I want to constantly try to manage this cortisol so everything else I do doesn't get stolen. But here we're back to here. Like there's components to it. Stress doesn't go away with one thing. I usually have to use multiple components to get rid of stress. This is only here to be confusing, but it's not confusing because you have a lot of different items here that manage stress. Your body wants the one hormone you cannot live without is cortisol. I could take all of your estrogen away, you will be alive. I could take your testosterone. I can take your thyroid. You will age really fast, but you will still be alive. But your cortisol cannot go away. You must have it. So there's so many different pathways leading to it and coming from it that you can never completely block it. You can only keep it at a level that your body can handle. And there's all these feedback loops in your brain that measure what's going on. And so it's several different pathways happening. So in order to impact stress, I might have to do 1, 2, 3, 4, 5, 6, 7, and this is a simplified view. 7 things. So a lot of times I'll give people a plan and then I'll say, but you also have to take this herb and this other thing to manage your cortisol. And they'll be like, yeah, I kept taking the thing you prescribed, but the other stuff, what was that? I forgot. And I'm like, that's why the plan didn't work, because you have to be blocking all these different little things. So one of the things we measure is something called C-reactive protein, which tells me the inflammation in the body. It doesn't tell me why you're inflamed. It's just like when we're back up here, if this is happening, this is happening, this is happening, and you've got a cold and you've got pain, and then you have chronic migraines, all these things might be happening, and they will all influence the inflammation in your body. CRP doesn't tell me that this 28% that your husband's bothering you is the problem. It doesn't tell me this 33% that your knee, it just tells me overall, it's a lot. That's what CRP tells me. There's a lot of stuff. So if you've got trauma, tissue damage, any infection, any inflammation, any emotional stress, your body will kick out this factor. The higher the CRP level, the more inflammation is in your body. It's not specific. It's not unique to one disease. But if your C-reactive protein is 10 and we start doing things, I can be like, oh, now it's 5. Now I know that we did something. Oh, now it's 1. Ideally, it should be 1, but I never see anybody at a 1. It's usually at 3 or less. I'm like, good, we're working it out. But when it starts as a 10, I'm like, yeah, we can do better. So C-reactive protein, what is optimal? CRP can be 10 to 1,000. I usually do the highly sensitive CRP, which gives me like 1 to 10. Over 10, we're like, okay, that's a lot. They've decided less than 1 is optimal because that's how young people are. But like I said, when I see a lot of older people, and it's never 1 unless they're on powerful drugs, falsely lower it. Okay, so here we go. CRP and all the things that influence lifestyle, obesity, atherosclerosis, hypertension, all sorts of things go in your CRP. So one way we can measure CRP is just asking and measuring. And another way is there's a lab that sort of gives us a concrete number. Women are a special risk group. Women are particularly vulnerable. And let's look at post-traumatic stress disorder. So there's stress that can happen. I just lost my car keys. That's stress. That's not necessarily chronic stress, and that's not necessarily post-traumatic stress disorder. Then there's chronic stress. I'm at work, it's a hard, demanding job, and it's just how it is, and I'm going to be under stress for years. That's another thing. But then there's also stress that's so traumatic that it leads to long-term problems. It's either so chronic, like sometimes after you've been in a long-term stressful situation, you have PTSD. You constantly relive what's happening and you are hyper vigilant. It changes you permanently or nearly permanently. So post-traumatic stress starts within 1 month of a traumatic event. Symptoms might not appear till years later. It causes problems in your social or work or sleep or your daily tasks. You might reroute how you go to work because you got in an accident on the way one day and you can't pass that place again. So the symptoms are grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and they can vary over time. 2 people can experience the same stress, but not have the same response. Just like we would look different in 2 dresses. No, but women are twice as likely to get PTSD than men. We already said they're a group. I don't know if they're more likely to report it or be in therapy, and that's why the numbers are weird, or men hide it and don't admit it, but that's what the data shows. All right. So traumatic events. PTSD is not a mental illness. It is a psychological injury. So you get a traumatic event, an assault, an attack, abuse, natural disasters, accidents can traumatize you. And then your brain changes. It can change. Your hippocampus, the area of your brain that helps you distinguish between past and present memories, can shrink. The amygdala helps us process emotions and is linked to fear responses. It becomes hypervigilant. And one of the part of your brains that regulate your emotions can shrink. So chronic stress can change your brain. Acute stress, like I lost my keys, shouldn't change my brain, but chronic stress and a very dramatic, unusual life event can permanently change my brain, and we got to dial back from that. So let's talk about COVID and stress. With regard to COVID, they're just saying a lot more pathology because people are already walking around at a baseline stress of 50. All you need is that extra 50 of COVID, and now you're at 100. You know what I mean? You could take your normal 50 stress and make it into 100 just to have that language of what we looked at before. So if we were all at 0 stress and COVID happened, that's one thing. But we were all at 50 and then COVID happened. And COVID came with other things: change in work schedule, change in school schedules, change in your kids, change in being able to socialize, change in how you can offload the stress. And there we are. So more about PTSD. So how do we treat chronic stress and stress. I've lumped them because a lot of the things we're going to use for our chronic stress are tools we're going to use for an acute stress that lingers. Biofeedback, hypnotherapy, meditation, different types of counseling environments, yoga, all of these things have been shown to be helpful because it's a chronic problem. We find things that you will chronically do. There's no one-time intervention and you're done. Something that you include in your life. Then there's other alternative options, PTSD and stress. Okay, so 9 times out of 10, if you go to the doctor and you tell them you're depressed, stressed, anxious, or have PTSD, there are a couple of drugs that actually are indicated for PTSD, but sometimes they're going to off-label something. So Paxil is a drug that you can use for post-traumatic stress disorder and panic disorder and anxiety, all sorts of things. Zoloft is indicated for PTSD. Prozac, not indicated for it, could be used. Lexapro, depression and anxiety. Effexor, panic disorder. Benzodiazepines, so there's lots of different things, but they all have side effects. And even if they work for the component that they're working for, remember I told you when we looked at this graph before, some people have some component of physical pain and different components to their social stress. So it might help 25%, but it might not help 100%. Zoloft won't fix your husband unless he takes it. So that's the drug way. By the time people come to me, they've already frequently tried this. They're still on it, or they're trying to avoid it. Those are the 3 groups of people I get. I'm on it, I'm avoiding it, I tried and failed it. So then they come to me, and my job is to help you boost your happy hormones. And there's natural ways to do that. I always have to address that. I can't just be like, and here's another drug or another hormone. We always have to say, are you doing your due diligence? A lot of times people, meditating is great. And a lot of times people think, oh, I have to sit here and learn to meditate. No, I usually just throw my headphones on and go for a walk. That's perfectly fine. And there'll be all kinds of curse words in the song. I'm sure that's not what meditation is supposed to be, but oxytocin is your happy hormone. Pets and hugging and things like that help you secrete your natural bonding hormone. Endorphins are the hormones you release that make you happy and help you with pain. So a lot of times when people tell me they're in pain that won't go away, we're all technically in pain that won't go away. If you have enough endorphins, you don't notice it. If you notice it all the time, you probably lack endorphins. Exercise could help, but you're in too much pain to help. So anyway, we'll talk about boosting endorphins. And serotonin is the hormone that's good for weight. Serotonin. So when they're giving you those SSRIs, Zoloft and Lexapro, those are serotonin reuptake inhibitor. So you have serotonin, which is one of your happy hormones, and then they send a medication to block the receptor so the serotonin has to hang out. Like, you have barely any, let's keep using it and recycling it, and let's reuse the pans, let's reuse the tinfoil, let's just keep washing the plate and reusing it. It's doing that. It's not giving you a new plate, it's washing it over and over so you can keep using it. So serotonin, sunlight, go for a walk, meditating. There's also different natural things that boost all of these things, but you can naturally boost them for free. So this is the free way that works on a component. Remember, we talked about there could be several components to your issue. It works on a component, but sometimes we need to bring in more. So one of the more, low dose naltrexone. So there's a study that showed how this addiction drug, it's an addiction drug, stops people from using alcohol, drugs, and sugar. It's actually a component to an FDA approved weight loss drug because sugar is just as addictive as alcohol and heroin. So this drug messes with that system. And because it boosts your endorphins, which is your happy chemicals, and your pain chemicals, helps you with happiness and pain. If I have somebody who lacks happiness and has pain, I am capable of prescribing this. And there have been 2 300-page books written about this drug. that your doctor does not know about because it's off label to use it the way we're using it. It is on label. If you go to an addiction clinic, they know about it. But a regular doctor would not use it for anything but addiction. So it's used for immune health because your endorphins are part of your immune system. When you're very stressed, your immune system goes down. When you're very happy, the opposite. Reduces inflammation. They use it in multiple sclerosis. They use it in depression. They use it in PTSD. What else? Autoimmune diseases, cancer, autism, depression, inflammatory bowel disease, Lyme disease, skin conditions. So all of these things that this drug is off-labeled for. Okay, another thing that I can prescribe. So of course, if you go hug somebody, you can create oxytocin. How much oxytocin? All of our hugs are different doses. If you already have plenty of it, you hug and there's even more. And if you have barely any, you can make more, but it's not that much more. So anyway, so doing it naturally is a variable, even though it's helpful, but I can prescribe it. If I want you to have 100, you have 100, not 5 that you get from a hug, but 100. So I do prescribe it. On label, it is a labor drug. It puts you into labor. That is the only indicated use for oxytocin, labor induction. But you can off label it for hugs. I can prescribe hugs. And it comes from the same area in your brain that cortisol is secreted from. And when oxytocin is given, the factory switches over to producing oxytocin. So the cortisol goes down. So it's like the one hormone I can give you that won't get stolen and corrupted by cortisol. It lowers the cortisol. It increases the ability to act socially, which help. That's why they give it to autistic children. Instead of playing by themselves with the toy, they'll start seeking human interaction, which is important. So oxytocin is your neurochemical that stirs feelings of connection, care, trust, and empathy. And cortisol is the stress, and they're like on little scales. When one's high, the other one's low. When the other one's high, this one's low. They work on a little seesaw here, and I prescribe this a lot, especially older women. So I always tell people this story because we don't measure oxytocin. I don't draw your blood and measure it. We just don't do that. It can be done. It's not useful to do because I can ask people a few questions and find out if they don't have any. So I'm like, you know how you'll have a 25-year-old woman who just had a baby and the baby cries all the time, but she's okay. She thinks it's cute. Throws up on her. That's so cute. I love it. You can give her 1 or 2 babies and she's fine. Oh, yay, more babies. Right? Okay, we don't all feel that way about it, but she does because she's 25. It's cute. But leave the same 2 babies with a guy. Just find some 30-year-old guy and be like, watch these kids for me. He will call that woman every 20 minutes. What's happening? Where's this? Oh my God, when are you coming back? He didn't have the oxytocin to calm him down and think this is fun. I'm bonding. It's babies. Oh my God, baby. He doesn't do that. It's not, no. He does not have that hormone. Okay. So you think all women have it? No. Hand those babies to a 60-year-old. When you gonna come get your kids? Like there's a certain type of person that has plenty of this hormone. We're not all capable of accessing the same amount of this hormone. And even if we had it when we were 25, it dwindles by the time we are 60. It's just all of our hormones go away. That is one of them. Oxytocin can help with weight loss. When your cortisol is high, you get what? Belly fat. When it's low, and this can make it low, it changes that relationship. So oxytocin is another thing. And endorphins and oxytocin are something I will tell you how to increase naturally with herbs. But I'm just telling you, these are the studies are done on the drug, not the herbs. That's oxytocin. I prescribe both of them a lot. So yeah, oxytocin, here's the study. They're giving it intranasally to prevent PTSD. So here's another study. They gave it to rats. So this first study on oxytocin talks about early exposure and trying to prevent the PTSD from setting in. It's preventing, hi, a trauma happened. Oh, you were robbed yesterday or attacked. Let's give you oxytocin now so you don't have this 20 years from now. But here is another study that said, oh, well, these people are already have PTSD. They're not people, they're rats. The rats have PTSD. And even long after the trauma, it reprocesses the memories and helps them. So remember how I said an acute trauma can change your brain? Well, sometimes I have to send hormones to your brain to try to edit that. It's also the hormone released during orgasm. So sometimes I'll ask women, what's up with your orgasms? Are they weak? I don't need your blood for oxytocin. You just told me. All right, post-traumatic stress disorder and stress. So there's a peptide called C-Lank. Ignore this. This is from some other country, but it is a peptide that goes to your brain and helps with your brain. It's a very good brain tonic. C-Lank. Ketamine. Ketamine is a horse tranquilizer. No, it's originally developed as an anesthetic for humans and animals. But they have all these ketamine clinics popping up where they give people IV ketamine for post-traumatic stress disorder and chronic pain and migraines and all sorts of other things. It's also known as the street drug Special K. I have other things to prescribe, like low-dose naltrexone and oxytocin that people can take forever. But ketamine is something, and I even have C-Lank, which I use a lot for focus and memory. It just happens to also help with stress. But ketamine is something that can be given in tiny doses sublingually to help with PTSD that doesn't respond to other things. It's never the first thing I'm going to give someone. It's usually added on after I do lots of other stuff. I'll put it after the other stuff. There we go. Okay, so another thing that can be prescribed is cannabis with THC. THC is actually, in Texas, it's one of the indicated reasons to give medical marijuana. You can give endorphin booster, naltrexone, oxytocin, C-Lank, cannabis, or ketamine, the horse tranquilizer. All right, so that's all the prescription stuff. We went through antidepressants. We've been through off-label weird things to secrete your happy chemicals. But then let's naturally do it. Stress, PTSD, and essential oils. Because you don't need a prescription. Everything I've described so far is things that can be prescribed. Some I do, some I don't. But anyway. But now we're going to talk about essential oils. And there are lots of them that have been studied. Back to essential oils. Now we're on the natural stuff that you can do. So now you want notes. Okay, so frankincense is one of the oils that can help. They did a study. They applied them topically. They used rats, and they found them beneficial. Melissa is also known as lemon balm, and they used it in actual patients that were having heart problems in the emergency room. And they had them inhale it from the bottle, maybe on a cotton ball. I guess they gave it to a cotton ball. And it helped with their stress and it changed their hemodynamic measurements. 2 drops of Melissa oil. That is what they gave them. And it changed, physically changed them quickly. Citrus oils, they diffused it. And hospital employees, they completed surveys about their stress. And they said they definitely felt relaxed. People are happy when they smell oranges. Lavender on stress. They found that lavender significantly reduced stress. They studied a capsule. I think this is in Germany. Yes, it's approved in Germany for restlessness. And they found that lavender in a capsule was similar to Paxil, 20 milligrams. Ylang-ylang people transdermally. They had 40 people. They did measurements like their pulse and their breathing and their blood pressure and even a rating of their own, how the people felt about it. And it helped their blood pressure, their skin temperature, and they did rate that their stress was better. Valerian. So I guess they shocked people and caused them psychological stress. And it helped with 5-HTP, which is serotonin, and norepinephrine. In the hippocampus, remember we talked about the area of the brain that changes, and the amygdala, the area of the brain that changes. So valerian. Brain rewiring. Valerian extract alters functional brain connectivity. So they used EEGs and checked their brain waves, and they were like, oh yeah, valerian changed that. CBD. So this is cannabidiol. This is the CBD without the THC. So THC, yes, can be prescribed and is indicated for PTSD. But CBD alone can help. Serotonin receptor. Preliminary clinical trials say it's anxiolytic, antipsychotic, antidepressant, and has a positive risk-benefit profile. We discussed oxytocin earlier and how I can prescribe it, but there are essential oils that provoke it. So they use saliva to check baseline oxytocin concentrations. They gave people the oil, they had them smell it, then they rechecked. And it was these oils: lavender, neroli, jasmine, Roman chamomile, clary sage, and sandalwood provoked oxytocin. Inhalation of essential oils and vital signs. So they use different essential oils to see their blood pressure and pulse rate, and different vital signs were affected by the oils. They use lavender, rosemary, rose, eucalyptus, jasmine, geranium, chamomile, clary sage, thyme, and peppermint. And of course, they helped. Different ones helped with different components. Systolic blood pressure after all 10 of them. Prefrontal cortex. Remember earlier we talked about the prefrontal cortex and how it's weird? Okay, these helped. And the brain activity. So, see, useful things, oils. Stress relieving supplements. So most of us suspect that the gut is affected when we are stressed. Some people get constipated, some people get diarrhea, some people can't eat, some people just their stomach hurts, but things happen. And lots of studies have been done on melatonin in helping this gut-brain axis and probiotics. Just remember that. So probiotic, the specific strain that was studied was L. plantarum, which helps with stress and anxiety and helps with memory and cognition. There was a study on that. Then we'll go into vitamins. When people are stressed, not only does your body secrete sugar so you can run, other vitamins get recruited to help and are depleted in this process. B vitamins, vitamin C, magnesium, depleted. Someone's under chronic stress and they're not supplementing with these things, they're usually at a deficit. Even if you're getting them out of your diet, you're burning through more than you think. It's like your regular budget might be one thing, but all of a sudden your house burns down. That's a whole different amount of money. And if it's constantly doing that, you constantly need this different amount of money. And if you do not, then you run into a problem. So vitamin C is one of the things. Bioflavonoids are found in food. There's citrus bioflavonoids, so they're found in citrus fruits, but there's other things that have bioflavonoids that also help. A lot of times vitamin C and bioflavonoids are together. So usually I have people look for that since bioflavonoids by themselves help with stress. Vitamin C by itself helps with stress. They're usually frequently found together, not all the time, frequently found together. Vitamins that get depleted during stress. So one trial did magnesium and vitamins B6, and it decreased their stress score. Melatonin is in sleep essence with lavender in a capsule. We talked about a lavender capsule. And now there's melatonin in this one. And it helped. All right, now herbs. Here is an herb, ashwagandha. A lot of people have heard of ashwagandha. Here's what it looks like. I think the word means something about a horse. It smells like a horse. So they gave people ashwagandha and measured their cortisol levels, and their sleep got better and their cortisol gets better. Ningxia Red is a juice that had a study, and it was shown to reduce daily stress by 23% and help with energy and sleep and inflammation. Remember, we talked about inflammation and measuring that. So it does several things that we have been talking about. Ningxia Red, purple juice. They did another study on a supplement called Longevity. It's an oil. They inhaled this twice a day. Women inhaled it. And just inhaling it decreases fatigue, increases vigor. Smells like herb. So it's not like you're going to wear it as a perfume. I'm just going to throw that out there. That thyme and frankincense and clove, not gonna attract the opposite sex. Do not wear this tonight at the bar. Then they're doing studies. The two most popular supplements for stress are Stress Away and Peace and Calming. And they're doing a study on them now. But lots of people like those are just the top two popular favorites. And they're doing a study on CBD. They have a CBD that's mixed with citrus oils and a CBD that's mixed with lavender, which are already, and the one with lavender has ylang ylang in it. So we've already got several components that are useful. So here's Stress Away. It's relaxing, calming. You can get in a bath bomb if you like take baths every day. Get your dose that way. It comes in a roll-on. Carry it with you. Roll it on whenever you want. Then there's Peace and Calming. Comes in a roll-on. It has orange, ylang ylang, tangerine. So some of the oils we discussed. Progesterone, which gets stolen. Lower in chronic stress. Remember we showed the chart earlier. It gets stolen. And some women need to restore their levels. Once they decrease their stress, then they can work on trying to restore their progesterone using wild yam. So one of the summaries, this is a summary of the oils that reduce stress, the ones that produce oxytocin. Ask Andrea for the ebook that lists all these things for you, so you don't have to copy the slide down. Here's the supplements that we discussed. Supplements with ashwagandha, the supplements with melatonin, lavender, so a lot of them are combined. And thank you for your attention.